Hello, I'm Dr. Jane, and today we're going to talk about something that affects millions of men, but that many suffer with in silence. If you're a man over 60, or you know someone who is, this video could be one of the most important health messages you'll ever hear. Because right now, millions of men are suffering in silence with prostate problems that are completely robbing their quality of life. We're talking about waking up multiple times every night to use the bathroom, weak urinary flow that takes forever, that constant feeling of not being able to empty your bladder completely, and the embarrassment of always having to know where the nearest restroom is. But here's what the medical community isn't telling you loudly enough. In many cases, you can naturally shrink an enlarged prostate and reverse these symptoms without surgery or harsh medications. And today, I'm going to show you exactly how to do it, backed by cutting-edge scientific research. If you want to reclaim your freedom, your sleep, and your dignity, hit that like button now and subscribe so you don't miss any crucial health information that could change your life. Let's start by understanding what's really happening inside your body. The prostate is a small gland about the size of a walnut that sits just below the bladder and surrounds part of the urethra, which is the tube that carries urine out of your body. Here's the problem. As men age, the prostate naturally tends to grow larger. This condition is called Benign Prostatic Hyperplasia, or BPH for short. The word benign means it's not cancer, which is good news. But hyperplasia means excessive growth, and that's where the problems begin. By age 60, approximately 50% of men have some degree of prostate enlargement. By age 85, that number jumps to a staggering 90%. So if you're experiencing symptoms, you're definitely not alone. When the prostate enlarges, it squeezes the urethra like a clamp around a garden hose. This causes all those frustrating urinary symptoms: weak stream, frequent urination, especially at night, urgency where you suddenly have to go right now, difficulty starting urination, dribbling at the end, and that feeling of incomplete bladder emptying. But the impact goes far beyond just bathroom inconvenience. Studies show that men with untreated prostate enlargement have significantly higher rates of depression, anxiety, reduced quality of life, sleep deprivation that affects cognitive function and cardiovascular health, social isolation because they avoid activities where bathrooms aren't readily available, and relationship strain due to nighttime disruptions and reduced confidence. One major study from the Journal of Urology found that men with moderate to severe prostate symptoms scored lower on quality of life assessments than men with diabetes or heart disease. Let that sink in for a moment. Now here's what most doctors will tell you. They'll usually start with watchful waiting if symptoms are mild. Then they'll prescribe medications like alpha blockers that relax prostate muscles, or 5-alpha reductase inhibitors that actually shrink the prostate by blocking hormone conversion. If those don't work adequately, they'll discuss surgical options like TURP, which stands for transurethral resection of the prostate, or newer procedures using lasers or steam. And yes, these treatments have their place, especially in severe cases. But here's what they often don't emphasize enough. Natural interventions can be incredibly effective, especially when started early. And even if you're already on medication, these natural strategies can enhance those effects and potentially allow you to reduce dosages over time under medical supervision. So what does science actually say works? Let me share the most powerful natural interventions backed by rigorous clinical research. First, saw palmetto extract. This is probably the most studied natural remedy for prostate health. Saw palmetto comes from the berry of a small palm tree native to the southeastern United States. Multiple clinical trials, including a comprehensive review in the Cochrane database, have shown that saw palmetto extract can reduce nighttime urination by an average of 37%, improve urinary flow rate significantly, and reduce prostate size by up to 28% in some studies after 6 months of consistent use. The mechanism is fascinating. Saw palmetto inhibits the enzyme 5-alpha reductase, which converts testosterone into dihydrotestosterone, or DHT. DHT is the primary hormone that causes prostate enlargement. By blocking this conversion, saw palmetto essentially removes the fuel that makes the prostate grow. The recommended dosage is 320 milligrams of standardized extract, usually divided into 2 doses daily. Look for products standardized to contain 85 to 95% fatty acids and sterols. And here's important, it takes 6 to 8 weeks to see significant results, so patience and consistency are key. Second intervention, Pygium africanum extract. This comes from the bark of the African plum tree and has been used for centuries in traditional medicine. A meta-analysis of 18 clinical trials involving over 1,500 men found that Pygium significantly improved urinary symptoms, increased peak urinary flow, and reduced residual urine volume in the bladder. Pygium works differently than saw palmetto. It reduces inflammation in the prostate, inhibits prostate cell growth at the cellular level, and improves bladder muscle function. The standard dose is 100 to 200 milligrams daily. Many men find that combining Pygium with saw palmetto provides synergistic benefits, meaning they work better together than either does alone. Third, beta-sitosterol. This is a plant sterol found in many foods, but you'd need to eat massive quantities to get therapeutic amounts, so supplementation makes sense. Multiple studies, including a rigorous trial published in The Lancet, showed that beta-sitosterol improved urinary symptom scores by 40%, increased maximum urinary flow rate by over 50%, and significantly reduced residual urine volume. The typical dose ranges from 60 to 130 milligrams daily. What's remarkable about beta-sitosterol is how quickly it works compared to other supplements. Many men report noticeable improvement within 2 to 4 weeks. Fourth intervention, stinging nettle root. Don't let the name fool you. This plant has powerful medicinal properties. Stinging nettle root contains compounds that inhibit the binding of DHT to prostate receptors, reduce inflammatory markers in prostate tissue, and improve urinary flow parameters. German studies, where herbal medicine is more mainstream, have shown that stinging nettle root, especially when combined with saw palmetto, produces results comparable to prescription medications for mild to moderate BPH. The standard dose is 300 to 600 milligrams of root extract daily. Now let's talk about pumpkin seed oil. This might surprise you, but pumpkin seed oil is a prostate powerhouse. A Korean study published in Nutrition Research and Practice found that men who took 1,000 milligrams of pumpkin seed oil daily for 12 months experienced significant improvement in urinary symptoms, increased maximum flow rate, and improved quality of life scores. Pumpkin seed oil is rich in zinc, which is crucial for prostate health. The prostate contains more zinc than any other organ in the body, and zinc deficiency is common in men with prostate enlargement. The oil also contains plant sterols similar to beta-sitosterol and essential fatty acids that reduce inflammation. You can take this as a supplement, typically 500 to 1,000 milligrams daily, or you can consume actual pumpkin seeds. About a quarter cup of raw pumpkin seeds daily provides substantial benefits. Many men enjoy adding them to salads, yogurt, or eating them as a snack. Lycopene deserves special attention. This powerful antioxidant gives tomatoes their red color, but it's also found in watermelon, pink grapefruit, and papaya. Harvard researchers conducted a study following over 47,000 men for several years and found that those with the highest lycopene intake had significantly smaller prostates and fewer urinary symptoms. Lycopene appears to inhibit prostate cell proliferation, reduce oxidative stress in prostate tissue, and modulate inflammatory pathways. The catch is that you need consistent intake over time. The therapeutic dose is about 10 to 30 milligrams daily. You can get this from 6 to 8 tablespoons of tomato paste, or about 2 cups of tomato sauce, or lycopene supplements, which are more convenient for most people. Here's a pro tip. Lycopene absorption increases dramatically when tomatoes are cooked with a little healthy fat like olive oil. So that marinara sauce on your pasta isn't just delicious, it's actually therapeutic. Now let's discuss lifestyle modifications that are absolutely critical. First, exercise has profound effects on prostate health. A Swedish study following over 30,000 men for several years found that those who exercised regularly had up to 25% lower risk of developing BPH. And for men who already had prostate enlargement, regular exercise reduced symptom severity significantly. Why does exercise help? It reduces systemic inflammation throughout the body. It improves insulin sensitivity, and insulin resistance is linked to prostate growth. It helps maintain healthy body weight, and obesity is a major risk factor for BPH. It improves circulation to the pelvic region, and it supports healthy hormone balance. The best types of exercise for prostate health are moderate intensity aerobic exercise like brisk walking, swimming, or cycling for at least 30 minutes 5 days per week. Resistance training 2 to 3 times per week to maintain muscle mass and metabolic health. And pelvic floor exercises, also called Kegel exercises, which strengthen the muscles that control urination. Here's how to do Kegel exercises correctly. Identify the right muscles by stopping urination midstream. Those are your pelvic floor muscles. Then, when not urinating, contract these muscles and hold for 5 seconds, then relax for 5 seconds. Work up to holding for 10 seconds. Repeat this 10 to 15 times, 3 times per day. Many men report significant improvement in urinary control and flow after consistently doing Kegels for 8 to 12 weeks. Diet plays an enormous role that most men completely underestimate. Let me share the dietary patterns associated with healthier prostates. First, dramatically reduce or eliminate inflammatory foods. This means cutting way back on refined sugars and processed carbohydrates. Research shows that high sugar intake increases insulin resistance, which promotes prostate growth. Processed meats and red meat, especially well-done or charred meat, have been linked to prostate inflammation. Excessive dairy consumption, particularly whole milk and cheese, may increase risk due to calcium and hormones. Instead, emphasize anti-inflammatory foods. Load up on cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, and kale. These contain sulforaphane and indole-3-carbinol, compounds that help metabolize excess estrogen, which can contribute to prostate enlargement. Fatty fish like salmon, mackerel, and sardines provide omega-3 fatty acids that powerfully reduce inflammation. Aim for 3 servings per week. Green tea deserves special mention. Japanese men have among the lowest rates of symptomatic BPH in the world, and researchers believe green tea is a major protective factor. Green tea contains catechins, particularly EGCG, that inhibit 5-alpha reductase, reduce prostate inflammation, and may even induce death of abnormal prostate cells. Drink 3 to 5 cups daily for maximum benefit, or take a standardized extract providing about 400 milligrams of EGCG. Berries, especially blueberries, strawberries, and blackberries, are packed with antioxidants and anti-inflammatory compounds. A study in the American Journal of Clinical Nutrition found that men who ate berries regularly had lower inflammatory markers and better urinary function. Aim for at least 1 cup of mixed berries daily. Healthy fats from sources like olive oil, avocados, nuts, and seeds support hormone production and reduce inflammation. One Mediterranean diet study found that men following this eating pattern had 41% lower risk of developing BPH. Hydration strategy is critical, but often misunderstood. You need adequate fluids for overall health and to prevent concentrated urine that irritates the bladder. However, the timing matters enormously. Drink most of your fluids during the day, especially in the morning and early afternoon. Limit fluid intake after 6 p.m. Avoid all fluids 2 to 3 hours before bedtime. This single change can dramatically reduce nighttime bathroom trips. Also, limit or eliminate bladder irritants. Caffeine from coffee, tea, and energy drinks can worsen urgency and frequency. If you must have caffeine, limit it to mornings only. Alcohol relaxes the bladder neck and can worsen symptoms. It also increases nighttime urine production. Artificial sweeteners, particularly aspartame, can irritate the bladder lining. Spicy foods can aggravate urinary symptoms in some men. Stress management is another crucial but overlooked factor. Chronic stress elevates cortisol and inflammatory cytokines, both of which can worsen prostate symptoms. A fascinating study from UCLA found that men who practiced daily stress reduction techniques had measurable reductions in prostate inflammation markers after just 8 weeks. Effective stress management techniques include meditation or mindfulness practice for at least 10 to 20 minutes daily, deep breathing exercises, especially before bed, adequate sleep of 7 to 8 hours nightly, as poor sleep worsens inflammation and hormone imbalance, regular social connection, as isolation increases stress hormones, and engaging in hobbies or activities you genuinely enjoy. Let me share 3 real-case examples. Robert, 67 years old, was waking up 5 to 6 times every night. His doctor recommended surgery, but Robert wanted to try natural approaches first. He started taking saw palmetto, pyjam, and pumpkin seed oil. He cut out sugar and processed foods, added daily walking and pelvic floor exercises, and stopped all fluids after 7 p.m. After 3 months, he was down to 1 to 2 bathroom trips per night. After 6 months, his urinary flow had improved so much that his urologist was amazed. His prostate size had decreased measurably on ultrasound. Robert avoided surgery and reports feeling better overall than he has in years. James, 72 years old, was already on medication for BPH, but still had significant symptoms. He added the natural protocol on top of his prescription. Within 2 months, his symptoms improved so much that his doctor was able to reduce his medication dose by half. James says the combination approach gave him his life back. David, 61 years old, caught his prostate issues early. He started the natural protocol before symptoms became severe. 3 years later, his prostate size has remained stable instead of continuing to grow, and he has minimal symptoms. His doctor told him whatever he's doing, keep doing it. Now let's talk about the supplement protocol I recommend. This is what I suggest for most men over 60 with mild to moderate prostate enlargement. In the morning, take saw palmetto extract 320 milligrams, beta-sitosterol 60 to 130 milligrams, and vitamin D3 2000 to 4000 IU, as low vitamin D is linked to prostate problems. In the evening, take pyjam extract 100 to 200 milligrams, stinging nettle root 300 milligrams, and zinc 30 to 50 milligrams, as most men with BPH are deficient. Also add omega-3 fish oil 1000 to 2000 milligrams for anti-inflammatory effects, and lycopene 10 to 20 milligrams. For quality, choose supplements that are third-party tested by organizations like USP, NSF, or Consumer Lab. Look for standardized extracts with specified percentages of active compounds. Buy from reputable brands, even if they cost a bit more. And start supplements one at a time to identify any that might not agree with you. It's important to discuss precautions and when natural approaches aren't enough. These natural interventions are generally very safe, but you should consult your doctor before starting if you take blood thinners, as some herbs can increase bleeding risk. If you take medications for high blood pressure, as some supplements may enhance their effects. If you're scheduled for surgery within 2 weeks, stop all herbal supplements as a precaution. Or if you have liver or kidney disease, as supplement metabolism could be affected. You must see a doctor immediately if you experience complete inability to urinate, which is a medical emergency, blood in urine, which could indicate infection, stones, or other serious conditions, severe pain in the lower abdomen, back, or during urination, fever along with urinary symptoms suggesting infection, unexplained weight loss, or sudden worsening of symptoms. Also, even with natural treatment, you should have regular monitoring. Get a baseline PSA test to rule out prostate concerns that need different treatment. Have a digital examination by your doctor annually. Monitor symptom improvement using a standardized questionnaire your doctor can provide. And consider an ultrasound to measure prostate size at baseline and 6 months later to objectively track progress. For realistic expectations, understand that natural interventions work best for mild to moderate BPH. If your prostate is severely enlarged, you may need conventional treatment, but natural approaches can still help as complementary therapy. Results take time. Most men see initial improvement in 4 to 8 weeks, with maximum benefits at 3 to 6 months. Consistency is absolutely essential. Taking supplements sporadically won't work, and individual results vary based on age, overall health, severity of enlargement, and genetic factors. Let me give you a practical action plan. In week 1, start a symptom diary tracking nighttime bathroom trips, daytime frequency, and urgency episodes. Take baseline measurements if possible with your doctor. Begin with just 2 supplements, saw palmetto and pumpkin seed oil, to let your body adjust. And implement the hydration timing strategy immediately, as this alone can provide quick relief. In weeks 2 through 4, add beta-sitosterol and pygem if you're tolerating the first 2 supplements well. Begin daily walking for at least 30 minutes. Start practicing pelvic floor exercises. Cut out obvious bladder irritants like evening caffeine and alcohol, and load up on anti-inflammatory foods, especially tomatoes, cruciferous vegetables, and berries. In weeks 5 through 8, add the remaining supplements like zinc, omega-3s, and lycopene. Establish a consistent exercise routine including resistance training. Fine-tune your diet based on which foods you notice affect your symptoms. Practice stress reduction techniques daily and track your progress. You should start noticing improvement by this point. In months 3 through 6, continue the full protocol consistently. This is where maximum benefits occur. Have a follow-up with your doctor to objectively measure progress. Adjust supplements or dosages based on your response, and make this a permanent lifestyle, not just a temporary intervention. Here's a daily checklist you can follow. Upon waking, take morning supplements with breakfast. Do 10 minutes of light stretching or movement. Drink 16 to 24 ounces of water during the morning. Mid-morning, have green tea or another healthy beverage. At lunch, include lots of vegetables and some protein. Continue adequate fluid intake through early afternoon. Mid-afternoon, have a snack with pumpkin seeds or a handful of berries. Do your 30-minute walk or other aerobic exercise. At dinner, focus on fish, vegetables, and healthy fats. Take evening supplements after dinner. After 6 p.m., limit fluids to just small sips if needed. 1 hour before bed, do pelvic floor exercises for 5 to 10 minutes. Practice deep breathing or meditation for 10 minutes. Empty your bladder completely even if you don't feel a strong urge, and maintain consistent sleep and wake times. Let's quickly recap the 5 key points. Number 1, prostate enlargement affects the vast majority of men over 60, but you're not powerless against it. Number 2, specific supplements like saw palmetto, pyjum, beta-sitosterol, pumpkin seed oil, and lycopene have strong scientific backing for reducing prostate size and symptoms. Number 3, exercise, especially aerobic activity and pelvic floor strengthening, provides profound benefits. Number 4, diet matters enormously. Anti-inflammatory foods help, while sugar, processed foods, and excessive dairy harm. Number 5, consistency over 3 to 6 months is required for maximum natural shrinkage of the prostate. Imagine waking up just once or not at all during the night. Imagine having a strong, confident urinary stream again. Imagine not having to plan every outing around bathroom locations. Imagine feeling like yourself again, with energy and confidence restored. This isn't fantasy. It's what thousands of men have achieved using these evidence-based natural strategies. Your prostate doesn't have to continue growing and causing problems. Your quality of life doesn't have to continue declining. You have real options that work, backed by solid science. Let me answer some quick, frequently asked questions. How long before I see results? Most men notice initial improvement in 4 to 8 weeks, with maximum benefits at 3 to 6 months. Consistency is key. Can I do this if I'm already on medication? Absolutely, and you should. Natural approaches can enhance medication effectiveness. Just inform your doctor so they can monitor you and potentially adjust dosages down over time. Are there any side effects? The supplements mentioned are generally very well tolerated. Rarely, some men experience mild digestive upset that resolves by taking supplements with food. Saw palmetto occasionally causes mild headache in the first week or 2. Will this prevent the need for surgery? For many men with mild to moderate enlargement, yes. For severe cases, natural approaches may still help, but might not completely eliminate the need for procedures. However, even in those cases, you'll be healthier going into any procedure. If this video has given you hope and a clear path forward, show your support by hitting that like button right now. Subscribe to this channel and hit the notification bell so you don't miss future videos on men's health, natural treatments, and longevity. Share this video with other men in your life who might be suffering in silence. Your father, your brother, your friends. This information could genuinely change their lives. And comment below with your current situation. Are you dealing with prostate symptoms? Have you tried any natural approaches? What questions do you have? I read every comment and will create follow-up content based on your most common questions. Remember, gentlemen, aging is inevitable, but suffering is optional. Your prostate health is largely in your control. The science is clear, the tools are available, and the results speak for themselves. You deserve to sleep through the night. You deserve confidence and comfort in your own body. You deserve your quality of life back. Start today, not tomorrow, not next week. Choose 1 or 2 interventions from this video and begin right now. Your future self will thank you. Stay strong, stay healthy, and I'll see you in the next video.